While we heard a rosy picture painted by the governor today, the reality is that his actions, or more often his failure to act, have cost Oklahomans financially, emotionally, and physically. At times during the past year, instead of focusing on our state's pandemic response, and at times ignoring our surging COVID case numbers and hospitalizations, Governor Stitt has seemed to be distracted by national politics. Today's State of the State speech was no different. It was far from the call for unity that Oklahomans desire and expect. I've listened in the House chamber to now 11 states of the state. Today's speech was by far the most divisive. Unfortunately, the governor today in his speech chose to bring D.C. politics to Oklahoma, delivering more of a campaign speech than the united message that we need as a state and as a nation. The version of the last year that the governor attempted to sell to Oklahomans today was nothing more than revisionist history. Let me be clear. As COVID-19 rages in Oklahoma, January was our worst month yet. No state wishes that they would have responded to this pandemic the way that Oklahoma has. From his own lack of personal responsibility to the lack of public health policies driven by data, Governor Stitt's response to this pandemic has been an example of failed leadership. The governor has wasted taxpayer dollars, hidden information, misrepresented data, all in an effort to keep the truth from the public and hide the facts during the pandemic. So what would Democrats in the House have done differently? Well, first of all, we would have acted. Legislative Republicans have failed to condemn the governor's response and thereby have condoned his failure by remaining silent. We would have enacted a statewide mask mandate. We've been calling for that for many, many months. We've called for a bipartisan, expert-led panel to lead the state's response instead of politicians. We were the first to call for a color-coded system to alert the public of the actual risk and have pointed out the flaws in the current system. We have fought for protections for frontline workers and will continue to do so. We've pushed for the state to follow basic CDC guidelines and listen to the experts. We've asked the governor to stop hiding information, especially from municipalities who are trying to make decisions. And we've called for passing an extension of the Virtual Meetings Act to protect communities and the bodies that lead them. We must continue to act to ensure Oklahomans are safe, protected, and put in positions to succeed during this pandemic. Today, the governor offered what he called the people's agenda, but in our opinion, it's really the profit over people agenda. Instead of focusing on saving and protecting lives, helping working Oklahomans, the governor is focused on increasing profits for corporations. If he truly wanted to help working families, we would have heard about a higher minimum wage, paid family leave, increased access to higher learning. According to Forbes, Oklahoma is already in the top 10 for the cost of operating a business and has been for some time. It's our inability to invest in healthcare, infrastructure, and education that's costing us jobs. And finally, I would be remiss if I didn't mention the incredibly disrespectful tone that the governor took towards sovereign tribal nations in his speech today. I found it very telling that the only time we actually heard the word sovereign was in reference to the state of Oklahoma, not in terms of our sovereign tribal nations. We heard more fear-mongering and scare tactics from the governor, which has been his go-to attitude toward our tribal partners since the beginning of his term. And let me be clear, the Oklahoma House Democrats believe that tribal nations in Oklahoma are sovereign nations and should be treated as such, instead of being disrespected by the head of state in Oklahoma. At this time, I will turn it over to a few of our legislators who have COVID-related legislation to talk about those. First, we have Representative Jose Cruz, who's from House District 89 in South Oklahoma City.
Hello and good afternoon. The last year has obviously been one of the hardest years in modern history, not just for our state, but for our country and around the world. This pandemic has affected all of us in ways that we never could have anticipated. However, one constant variable has been the willingness of essential and frontline workers to put their safety on the line. Their selflessness has ensured that our communities have the resources to survive the pandemic. Despite their government's failure to protect them and limit the spread of COVID-19, healthcare professionals and first responders have risen to the occasion and been the true heroes during this pandemic. With the strain of long hours, understaffed shifts, and the constant fear of contracting COVID-19 and bringing it home to their loved ones, this pandemic has affected these individuals physically, emotionally, and mentally. Because of this, the need for our government to stand up for them is very important. I've introduced House Bill 1951, which will increase access to mental health services to these individuals by directing insurance carriers in Oklahoma to cover mental health services for essential workers. Essential workers include, but not limited to, healthcare providers, first responders, and workers at our grocery stores or other places in the food service industry. As Americans, Oklahomans, and your neighbors, this is the least that we can do. Thank you.
Good afternoon. I am Trish Ranson, House District 34 in Stillwater. It is often said that the number one barrier to innovation is, well, we've always done it this way. What we learned through our pandemic, through our emergency order, was that we can still do business by meeting virtually. That emergency order expired mid-November, leaving councils, boards, commissions, and coalitions without the ability to meet safely. House Bill 1758 is the bill that I have put forward that amends the Open Meeting Act to allow virtual as a manner of attendance and be counted in person for board members, but also for the public, and allows them to get a quorum virtually as well. Thank you.
Can everybody hear me okay? I forgot to bring my own podium, Forrest-sized podium. My name is Forrest Bennett, Forrest Bennett, House District 92. We're in House District 92 right now, so I really appreciate you all coming out and being here. I join in my colleagues' frustration over the lack of response and lack of responsibility that we've seen from some of our colleagues at the Capitol. And I think I speak for all of them when I say that after session ended early last year, we all sat at home frustrated that we couldn't do more immediately to solve this problem, to fix so many of the problems that have arisen out of COVID. And of course, we've always said we did not create COVID, but different states have handled it differently, and we have created problems of our own as a result. And I did stand and applaud for the first responders when the governor heaped praise on them. But I cannot look past the fact that we have sat by and ignored so many of the challenges that continue to arise from COVID. After the virus is gone, so many of the financial challenges that Oklahoma families face will remain. And the bad news is that a lot of that damage has been done. But there is so much more we can do in this still active crisis. And the good news is that some of the challenges that we face today require relatively simple solutions. One of the challenges is the issue of eviction. Countless Oklahoma renters lost their income through no fault of their own during this crisis. And I applaud leaders from both sides of the political aisle and all across the spectrum for understanding immediately that in the face of a pandemic like this, when they're losing their homes through no fault of their own, an eviction moratorium makes a lot of sense. But an eviction moratorium is not a permanent solution. And if my colleagues across the political spectrum agree with me that eviction for people who, through no fault of their own, have lost their incomes is a moral tragedy, then we should do something about it now. Eviction moratoriums were never the permanent solution, of course, because landlords have bills and utilities and mortgages that they need to pay as well. But as evictions are lifted, as the eviction moratoriums are lifted, I have the feeling that a lot of renters will be getting eviction notices. Many of these notices give renters 5 days to pay or they will be evicted. And for most renters, 5 days makes little difference in their financial situation, but most working Oklahomans get paid twice a month. While payday may not fall within a 5-day grace period, it's almost guaranteed to fall within that 15-day grace period. This isn't a solution for everyone, and it's not a silver bullet, but for Oklahomans who are working and are getting paychecks every 2 weeks, this might save their roof over their head and save their families from becoming homeless, which we all know creates further problems, not just for them, but for everyone in the state. So, I think this is an example of one of those small changes that could make a huge difference. This is an active crisis, and it does require quick and decisive action from us. We hope that our colleagues across the aisle will join us in pushing these bills forward as soon as possible so we can deliver much needed relief to the folks that we represent. Thank you for coming.
In closing, again, we want to recognize those hardworking healthcare professionals who are working in the building behind us. That's why we've chosen this location for today, so that we can recognize them and remind Oklahomans that although our numbers have gone down recently, as they have nationwide, we know that there are new strains, new variants, and we need to get more folks vaccinated. But right now, it is more important than ever to wear a mask at all times when you're in public, to social distance, and to stay home when possible. With that, I'll be happy to take questions.
I see a couple of, numerous Tulsa area representatives. Do any of you want to respond to the now solid month of TPS bashing?
I think I know someone who might.
Who wants to go first?
Yeah.
Melissa? Let me collect my thoughts. Thanks. I'm Melissa Provenzano. I'm at a House District 79. It's with great concern that our schools have been under attack. These children have been in school the whole time. Several of them have been in person at the younger levels, but virtual at all levels. And no one wants for our children to not be in school. We're all on the same page there, but we need the resources available to make sure that that can happen safely. One of the things that Tulsa Public Schools has called for is vaccines for their teachers, yet we can't seem to get them into arms fast enough. And I understand that's a nationwide issue, but there are several things we can do. Vaccines, upgrading ventilation systems, funding for protective equipment that seems to be diverted in other directions right now that are deeply concerning. And then today, to thread on this gauntlet of misunderstanding about what a ghost student is was embarrassing. And as state leaders, we need to understand what the funding formula does, why it does it that way, and to be able to apply it correctly. We're known across the nation for our funding formula, and it holds up over time. So we'll be working to educate and hopefully lift up the truth of the situation. And this is a large urban metropolitan area, and just days after the governor compared the urban area to surrounding districts, those surrounding districts shut down and went back to virtual. So let's stop and think about that for a minute, and stop and think about the teachers and the administrators and the school district personnel that are just trying to keep our kids and families safe.
Thank you for the question, Monroe Nichols. I'll just say really quickly that if the teachers and kids and families in Tulsa had a governor that truly cared about their health care and their education, their safety, they would have been in school months ago. But they don't have that. And so leaders in Tulsa are being responsible because our hospital capacity doesn't exist because of the governor's policies. And for that reason, kids are at home, not because of the responsible decisions that the superintendent in Tulsa and all the leaders are making. So this is about the governor's responsibility and his inability to protect Oklahomans. That's the reason why we got kids at home right now.
I would also like to say, being a representative from Tulsa, Oklahoma, that I've received 2 of the calls where there were 2 sisters that were teachers in Tulsa Public Schools. One of the teachers died. I had to take that call. I had to deal with that grief that family has to endure. So there's this whole concept that schools can be open safely. If we talk about the facts, we're going to talk about loved ones that have died, and we're going to talk about support personnel also. I got that call also where we lost a death, support personnel right there in Tulsa, Oklahoma. So we sat there and listened to this speech, but if you cannot recognize and acknowledge that real lives have been lost, real people are dying, then we're really not governing. We are left to govern ourselves. Thank you.
The last speaker was Representative Regina Goodwin from House District 73. Happy to take other questions.
Representative Bergen, I noticed I counted close to 20 lawmakers on the floor of the House not wearing masks, not social distancing. I know that legislators haven't had the vaccine made available, but do you have concerns about that given the age of many of your colleagues?
We have huge concerns about that for the safety of our colleagues, for the safety of our staff who work in the building every day, who I might add are required to wear masks. For some reason, we think that legislators are exempt from this rule requiring people to wear masks in public. It is beyond me why anyone would sit in that chamber and fail to set an example that is one of the simplest things you can do during this pandemic. What I would say is, some of them are saying we're making political statements. They're attempting to make a political statement by not wearing a mask. It's misguided, it's dangerous, it sets a horrible example. I can't imagine being one of the healthcare workers in this building behind me every day, helping loved ones say goodbye to their families on FaceTime. And then watching the supposed leaders of our state in that building today not wearing masks. It's abhorrent. I'm embarrassed. And I hope that those constituents who saw their representatives not wearing masks, that they contact them and they demand them to do better.
Governor Stitt says that we're working towards getting normalcy this summer. We want our summer to fight against COVID and see the finish line. I mean, that's a powerful statement to say, essentially, that all of this will be over by summer. Do you have a direct response to those comments?
I think that throughout this entire pandemic, the governor has set very unrealistic expectations. We heard him talk about fully opening up last summer. Well, even though we were fully open, businesses were still suffering and are still suffering because folks don't feel safe going to those businesses. What we really need to focus on is, of course, vaccination, and Oklahoma's doing well there thanks to leaders at the health department, but we need to focus on controlling the community spread, not just through vaccinations, but other means. And we heard nothing about that from the governor today. I listened to experts at the CDC and other public health experts who say it's probably going to be in the fall when we're back to some semblance of normal. But I think the governor has time and time again tried to rush things, and that has had devastating consequences for the state.
Elaborate a little bit more. You indicated the lack of transparency from the health department with respect to data going to the cities.
Yeah, that was I believe back in the summer or the fall when we were receiving information from the federal government and not passing that information on to municipalities when they were trying to make decisions about mask mandates, when they were trying to make decisions about virtual meetings. So that was really devastating to some of those municipalities because they wanted that guidance from the state, and time